Sure. Hi, everyone. I'm Samantha Furman, the Long Island Director of Agape. Um, we're here to talk about ADHD and trauma. So ADHD is one of the most common diagnoses that our children are often given, but it can be very confused with symptoms of trauma. And so we have our wonderful board president of AFFCNY, Sarah, here to teach us and lead us in discussion around that topic. So I'm going to turn it over to Sarah to introduce herself. Thanks for being here, Sarah, and everyone else.
Great, thank you. I'm so happy to be here tonight to meet with all of you. And, I think we're all kindred spirits. I'm going to share my screen, which is going to make, I think, eye contact very challenging. But then when I finish the presentation, we'll just go back to this format. And then if people want to talk a little bit, that would be terrific, I think. So hold on. Okay, so it says the host disabled participant screen sharing. So I need to,
Okay, 1 second. I'll fix that. How's that?
Perfect. Okay. All right. Somehow this is not in the right spot. Hold on. You're going to see this all in reverse somehow. Okay, there we go. All right, so just a little bit about myself. I'm a clinician, so a social worker who started working privately with families. They're all foster and adoptive families. And I also am a foster adoptive parent, which is probably my most valuable experience that is going to inform this presentation tonight. I just want to, before I forget, as Sam mentioned, I'm also the board president for the Adoptive and Foster Family Coalition. And I wanted to note that we're having our big fundraiser in October, on October 19th. So if you are in New York City or you want to attend virtually, we'd love to have you. We're going to be sharing stories, and all of this work really is about stories, and we would love to see you there. So this is our presentation for tonight, as Sam said. So here's the agenda. And I just want to say that I would love to hear your questions as we go through. Hopefully everything is clear. So you can ask questions as we go along, or we can also save some time at the end for questions then. I guess if there's anything that somebody's attending tonight and they're thinking, well, my question's not going to be answered by this agenda. If anybody wants to tell me what they had in mind when they decided to attend, I'd love to hear it now. Anything? Okay. All right, let's get started then. Attention deficit hyperactivity disorder is a neurodevelopmental disorder or a condition that affects how your brain functions. Right now, people aren't exactly clear. Why do people have ADHD? Why are some people born this way? Sometimes some people have theorized that there's environmental factors, but there's actually no evidence at this time that that's true. There is a genetic component, and it also is possible that there's like a combination of a genetic and environmental piece to things. So that makes something about your genetic makeup makes you more susceptible when you are exposed to a certain environment. So right here we have, I'm not sure if all of you are familiar with the Diagnostic and Statistical Manual. That's the DSM-5. That is if you heard me talk before, this is sort of my perspective on it. It's a group of people who've gotten together and they've decided, okay, this is the certain, these characteristics. We're going to give this group of characteristics this label. It's almost like as if people are making up their own dictionary. They're going to decide that this pen is defined in this certain way, and these paper means something else. So it's something that evolves over time. It's not set in stone. There's been things that are in the DSM that have changed over time, things that we would now probably view as ridiculous. So we're now in the 5th edition of the DSM-5, but it is kind of a standard. And if your child gets an evaluation and is given a diagnosis of ADHD, this is the criteria that people will use. So I wanted to just actually go through. So this people with ADHD show persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. So I think it's kind of interesting to look through this list. And I would like you guys to look through this list yourselves and think of how many of these characteristics you have yourself, right? So the first is often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or with other activities. Often has trouble holding attention on tasks or play activities. Often does not seem to listen when spoken to directly. Often does not follow through on instruction and fails to finish schoolwork, chores, or duties in the workplace. Often has trouble organizing tasks and activities. Often avoids or dislikes or is reluctant to do tasks that require mental effort over a long time, such as schoolwork or homework. And I think that one is particularly tricky because kids can have a learning disability, right? That might make them not want to do schoolwork, and it just might be the approach to learning that's being used. Often loses things necessary for tasks and activities. I remember once one of my kids got 10 pairs of socks for Christmas, and by January, I was explaining to the teachers, let me put it to you this way, she only has, I think 1.5 socks left of those 20 initial individual socks, right? That was like in January. So it's often easily distracted, is often forgetful in daily activities. So I think it's interesting for all of us to think about how many would we have on this list. You have to have 6 or more to actually get the inattentive label. For myself, it was like 2 or 3 on this list, but I do differently on the next. So this is about hyperactivity and impulsivity. Again, you have to have 6 or more on this list. I score much higher on this. I get 5 or 6. And I don't know if you need me to read the list, but these are common hyperactive things. We can't sit still. I think the classic is the child acts as if they're driven by a motor. They just don't relax at all. And I think a really important piece of this is it's disruptive or inappropriate for the person's developmental level, right? So, if you have a 2-year-old and they often leave their seat when, in a situation where they're remaining seated is expected, I mean, 2-year-old isn't going to sit in a seat very easily or for very long. So you have to really think about the child's age and what's appropriate for them. So this is a really important piece of this, the criteria to meet this definition. So it has to be these inattentive or hyperactive impulsive symptoms have to be present before the age of 12 years. And I would say it's probably going to be noticed much before 12 years. And they also have to be present in 2 or more settings. So not just at home, not just at school, right, in these various settings. So just thinking about those first 2 bullets, my first child who was an extremely active child. As soon as he could move around, wanted to not sit on people's laps and just be all over the place. We had many almost terrible accidents because he was just had to be watched every second. And that was just around the time that ADHD was coming out. And I thought, oh, well, maybe he has this ADHD. And then I took him to a story hour at the library, and he actually was super focused. So that was a different setting. So he was a very active child, but when he was very interested, he was able to focus. He continued to be very active. He's very active to this day. When we would eat dinner growing up, he would walk around our table. When you would read to him, he'd walk back and forth on his bed. So he was a very active child, but he actually could complete his schoolwork. And he has a job now, and he's, so he's active, but he wouldn't meet the criteria as hyperactive. And then the third bullet here is there's clear evidence that the symptoms interfere with or reduce the quality of school, social, school, or work functioning, right? Very important. So I have a nephew who probably would have every inattentive symptom. You check off all of those things. And he was also very forgetful. I remember once we went to visit them, he lives in Kentucky, and we drove from the countryside where my sister lives into town, and we realized he had not brought his shoes. He was 7 or 8. I didn't think to look at his feet to see. So we had to spend the whole day in the city with a child with bare feet, which was sort of remarkable. So he definitely would have met the criteria, but it wasn't in elementary school. He was actually able to function pretty well. It was just as he got older, his disorganization really impacted his ability to get schoolwork, especially in college. And then the last bullet, these symptoms are not better explained by another mental disorder. So you want to rule out things like general anxiety, autism, an auditory processing disorder. So an auditory processing disorder means you can actually hear, right? I can hear things from loud noises around me, but it's the sort of the connection between the ear and the brain. So I may not be able to clearly understand what you're saying. And so that can really impact a child's attention. And also alcohol exposure in utero would be another thing you would want to rule out. So we're going to talk a little more about that later. Here's just the different types: combined presentation, predominantly inattentive presentation, predominantly hyperactive or impulsive presentation. A while ago, this is a good example of an update in the DSM-5 and previous editions. They had separate disorders. One was ADD, attention deficit disorder, and then the other was ADHD, and now they've kind of modified that. So that's kind of the current, if your child gets that diagnosis, that's kind of how people are thinking about it. Next, we're gonna talk about complex developmental trauma. So I really don't feel that the DSM-5 is current on what I consider the, most thoughtful definition of complex developmental trauma. So I'm using this definition from the National Child Traumatic Stress Network. And I'm just going to read that to you. The complex trauma describes both children's exposure to multiple traumatic events, often of an invasive interpersonal nature, and the wide-ranging long-term effects of this exposure. These events are severe and pervasive, such as abuse or profound neglect. They usually, I've bolded this sentence because I think it's very important. They usually occur early in life and can disrupt many aspects of the child's development and the formation of a sense of self. That piece is so important. Since these events often occur with a caregiver, they interfere with the child's ability to form a secure attachment. I would say, I don't think often, they always occur with a caregiver, right? If the caregiver is taking care of the child and a traumatic thing happens, like a flood or a hurricane or pandemic, and the child is very well cared for and nurtured in that relationship, those events for small children are not that traumatic, actually. If the parent is, or the caregiver is staying calm, it's almost like this protective umbrella around the child, and they aren't going to see the effects that we see in the children that are not well cared for. Many aspects of a child's healthy physical and mental development rely on this primary source of safety and stability, right? So this is often also called adverse childhood experiences or pediatric PTSD. As Oprah and Bruce Perry wrote this book, which they call this "What Happened to You," right? What happened to you? Why are you feeling this way? There's a lot of research now that obviously it's not just the early life, but it's also in utero experiences that impact your development. Bruce Perry has good research now showing actually that the first 60 days after birth are very uniquely sensitive to poor caregiving, and that time period is more important than any other 60 days in your childhood. So I read recently, somebody says it's basically affects your body, your brain, and your heart. And I really think that really is such a great description. And it made me think about a report that I was writing recently for a child who came to the family. So, right, this complex developmental trauma impacts your body, your brain, and your heart. So he came to the family. He was in the 5th percentile for weight. 3 years later, he was in the 78th percentile, right? So he actually got to his probably natural body weight percentage-wise because he was loved and nurtured in a family. It's not just the amount of food you're given, but it's the environment that you're trying to grow in. There's another, a very famous study done in Romania, where some children were moved to a foster family from the orphanage, and they showed a 10-point increase in IQ when the child was moved into a family setting. So that's a very dramatic increase, right? Your brain, your body, and your heart, that's what's impacted. So these are common symptoms of complex developmental trauma. Poor sleep. There are studies that have shown how our hormones impact our sleep. So right, sleep is still a bit of a mystery to scientists. So why do we wake up when we do? Well, we know that certain hormones about 30 minutes before we wake up just kind of magically take us from the state of complete zombiness, really. You're just totally out of it, not even moving your body, or not in response to anything anyway. You're in your bed, and then all of a sudden you just wake up, right? There's this magic formula of these hormones that slowly start to increase, and then they slowly go down over the day, and then you are able to relax and magically fall asleep, and however that state change happens. But what we see in kids who've had a lot of trauma is this magical formula of hormones is off in some way, and so that those kids they don't have the same trend up and then slowly decreasing. And in fact, as the end of the day, a lot of you might notice that your kids get a little bit hyperactive when they're supposed to be going to sleep. And a lot of times there's a trend up in the hormones that actually keep you awake. They have a harder time staying asleep, more prone to nightmares and so forth. There's a lot of eating issues. I always say they're either overeaters or undereaters. That's, if we think about what's most important when you're an infant is that you're touched, and that you're fed, right? And those things are connected, right? Usually you're in a warm, cozy spot to be fed by your hopefully loving parent, right? And somehow that mechanism also gets out of whack, even if you're in an orphanage and you're fed enough. And then there's there's a great study, which I won't get into, but shows social anxiety and depression are really markers of complex developmental trauma, especially in middle school and early high school. Okay. So how are ADHD and complex developmental trauma different? So kids with healthy beginnings may struggle to do their schoolwork, but they fit easily in their family. And I'm talking about most, obviously, some kids don't fit and there's going to be problems. So I'm just sort of talking about the average. They have healthy and close relationships with their parents. Kids who live with their biological families and who have ADHD likely have close family members with similar biological makeups. So there was a study done in Sweden of 60,000 twins who had clinically diagnosed ADHD. And they could see that there was an 88% heritability of the ADHD, right? So it's definitely, there's a highly genetic component. I would say, just thinking in my own family, that, thinking of my sister and I are notorious trailers in our speaking. So we will be talking about something and then we start thinking about something off and we sort of trail off mid-sentence, and our families are always saying, what, could you finish what you're saying? So we're very distracted very easily. And so we're very similar in that way. I have an aunt who had 5 children. The third and fourth of the 5 have so much energy. She used to have them run around the house 10 times every night before dinner. They're super active. One of them has, as an adult, has a building where a business where he deconstructs old buildings, right? He has tons of energy. He's a super physical person. You could see that throughout his life, right? So kids with ADHD always have their symptoms. Again, right? This is back to that definition: at home, at school, on vacation, all the time, right? If that, the impulsiveness, all of that, you're going to see it consistently. So, again, so how are they different? Kids with complex developmental trauma, they vary in their symptoms. They will have what looks like extreme ADHD when they're feeling unsafe, like the week before school starts, or when something triggers thoughts and feelings about their biological family, or something frightening that's happened to them in the past. Or they may have no ADHD the beginning of vacation, like school vacation, or on a Saturday morning. So you're going to see like a real variation in the presentation. So one of my kids, just to focus on this point for a minute, had spent the first 5 weeks in a very unsafe shelter in New York City. And she was very sensitive to, even though she came to us at 5 weeks, right? If there was something that looked, I would say, like a rough neighborhood. So one time we came out of a train station that wasn't in maybe the best area of the city we were visiting. I didn't even think anything about it. You would have thought we were like in the middle of a terrorist attack and people were facing us with guns. She was so freaked out about it. And at first it was just totally shocking. But then, I sort of put the pieces together and understood what was happening. So that's kind of a typical thing. This also, I want to say, can also seem, it isn't always like the hyperactive response. It can seem very inattentive, like that they're almost like very sleepy even in response to situation. That often happens at school, which we'll talk a little bit more about. And then lastly, sometimes it's very hard to sort out if kids with complex developmental trauma, which we can be pretty sure of, because kids aren't going to come into foster care likely unless they've had these really hard early beginnings. If they also have ADHD, right? Because if we take a huge group of people, some of them are going to have ADHD. Are they then having if they have complex developmental trauma on top of that? Sometimes it's very hard to sort that out. So I would say if you have a child who is, never seems to be relaxed, there's, that anyway, that there can be layers of challenge, I guess. So let's talk a little bit about sorting it out. Right. So the first thing I think to really understand what is to think about the history of the child. What happened in utero? Was there drug exposure, alcohol exposure? They're very, very, very likely with stress, right? Drug exposure can bring challenges, but alcohol, as probably many of you know, is by far the most damaging exposure in utero with lifelong implications. So was the child in the neonatal intensive care unit, right? That's also a traumatic experience. Worked with many families who really think nothing of it, but when I asked them about the history, the child actually was in the NICU for 5 weeks, or sometimes longer. It's a very long time to be in a little box and not, be held and connected with a human being. The number of placements your child's been through, what that quality of care was like, whether it was in a foster family, whether it was in an institution, every single one of those moves, especially for infants, is extremely challenging, damaging, right? And then, of course, then you have the birth family history, and do the people in that biological family have ADHD, or there are other issues. So just be thinking about all of that. So the second thing you need to think about is behavior, right? Is it constant? Right? Like was more of an ADHD kind of thing, or is it episodic, which I would say is more of a complex developmental trauma, which is not to say that many of these kids don't have a pretty constant anxiety or feeling of unsafe, but it's going to vary a little bit. Like a lot of times when I ask kids, they, where they feel safe in their room. That's like the one space that they really feel very safe in. And again, complex developmental trauma, it's, ADHD is like a sort of more constant level of activity or inattentiveness. I remember the first mom I ever met, my first job, she told me that her son had ADHD. And I said, well, what does that look like? And she said, like, if I leave any toilet paper where he can reach it, he unrolls it every time, the entire roll of toilet paper. So she knew that was going to happen. It wasn't a huge or a surprising outburst. Yeah, so, and I think people often, right, it's not just physical, but it's verbal, like some kids who can be very mean, taking you kind of by surprise. That means they're probably triggered by something and feeling very insecure and unsafe. I remember being in the car with one of my kids once in a taxi, and who had been very upset. She had been in foster care, and I had gone to do a training at a foster care agency, and I brought her with me to do her homework. And I hadn't realized how just being in another foster care agency could trigger her, and how familiar, even though it had been many years since we had to have visits, And on the way back, she was really verbally, I would say, out of control, to put it politely. The taxi driver gave me a little talking to on the end about how I needed to take her to a psychiatrist. So, that's a ride we won't really forget. But, the next day I was able to piece it together and say to her, do you think this is, maybe you were feeling really unsafe there, not knowing what was going to happen? And of course, that was part of her early implicit memory. It wasn't, something we really talked about anymore so much. So that was just, took me off guard, and that, very much complex developmental trauma. So I also think that too, when I say episodic, I don't mean it has to be just like, half an hour or like one day or something. Sometimes actually kids can go through periods, like again, like in middle school or early high school, where they're feeling, they have a lot of thoughts about their biological family, and it's very distracting to them. So they can seem very inattentive. But it might be that, a few years earlier, their behavior wasn't like that. It's not their sort of personality. So, so why does it matter? Children with complex developmental trauma need to be understood to heal, right? It's all about the relationship. I'm sure all of you are really aware of that. And I love this quote here, that says a guy who writes about state of mind. It's a very interesting book. He writes about minds on drugs and all these different kinds of things, and how we can change our state of mind. And one little piece in there was about trauma. And it says the mental effort that a traumatized child must expend while trying to ignore and suppress these traumatic intrusions disrupts. So, right, I think that's what we don't see a lot. I was just talking to a school today, trying to explain to them that this happens to kids who look very normal on the outside, right? They have this traumatic intrusion that disrupts concentration, saps energy, and frays mood, right? Frays mood. That's a really good way to put it. Unfortunately, these cognitive disruptions and emotional lability are often mistaken for ADHD. So many of these kids get stimulant medications rather than therapy to address trauma. All right, so we'll talk a little bit more about that. So just a little bit more on the relationship building and the idea of therapy. That children need to integrate their histories into the arc of their lives, as well as have what I call secret misperceptions corrected for them, right? So I say secret because I think kids have a lot of thoughts about what happened to them, and they don't really think to say anything about it, because to them, it's just a fact in their brain, and they have lived in a different world than, before they came to you. So one wouldn't even think to ask them about it. So like an example, I remember one 13-year-old who said to me, half of me thinks I was kidnapped by my mother, and half of me doesn't. Like, I'm not really sure what to believe, right? Her mother had no idea but you could definitely imagine, she was adopted around 20 months. That experience felt like a kidnapping to her. These ideas about, whether it was one's fault, like was it a baby's fault or child's fault that they were abused or treated in the way that they were. So this communicating fully, whether it's with therapy or just with therapeutic parents. So communicating fully is the opposite of being traumatized. Part of what is traumatic is dealing with difficult and shameful memories, thoughts, and feelings alone. It can be both organizing and reassuring for children to know their story, speak their fears, and be validated and accepted by adults, right? And again, that can either be, in a family, sometimes a therapist is helpful. So here is a book that I just read this summer. This Leslie Kaplow teaches at Bank Street College in Manhattan. And I really loved this book. It's talking a lot about how one can bring the close relationships that work at home to school. So how teachers can develop these relationships and really understand children and in their fully, actually, right? The experience that they had before they started school. And so anyway, I really recommend this. She understands a lot about about trauma and the difference between ADHD and complex developmental trauma. So something to keep in mind, the brain continues to develop and many executive function challenges will get better through high school and early adulthood. They typically say around 25 or 26, right? So all kids should become better organized and less impulsive, right? That's something really, as the brain is developing, that, kids are not stuck in that developmental stage. They're, especially in a loving family, that they're going to be reaching their own potential in that way. So let's talk a little bit about things that will help. So no matter what it is, right, whether it's complex developmental trauma or ADHD, we can have adaptations in the environment, right? You can organize space, you can get tutoring support. Often that looks like preparing kids a little bit ahead of time for what's going to be taught in class. So they're already getting more organized in their own brains, rooms that aren't cluttered, to do reminders and all that kind of thing, right? So there's a lot, we can be more organized ourselves, and then that's a more organized environment for the child to be in, and that can help guide them. And then I say, or not, right? Because one thing that works for all people is our logical consequences. So sometimes that is actually the best way for a child to actually, I would say, be motivated. I think all kids want to do, the right thing and please adults around them. But it's sometimes having a logical consequence. So I'll give you an example. I had one child who, had a very lost and broken phone. So we didn't buy a new phone, right? So that's, she earned the money, and then that really helped her each time, because it took a long time to get a new phone, to actually think about how she was going to figure out for herself how she wasn't going to lose it. Because there's a lot of research that's showing that strategies that children figure out for themselves are actually more effective than the strategies that we think will be really good for them, right? So having logical consequences of situations puts them in, and with us never responding with anger in those situations, right? Us staying neutral, being empathetic. Oh my gosh, that's such a bummer. But then saying, well, kind of giving them the space to figure out, well, what do you want to do next? Or how are you going to figure out, the solution? So that, I love logical consequences. It really, with a loving parent, really gives kids the space to use their own brains. Okay, so lifestyle choices, exercise, be outside. Nim Tottenham at Columbia University has done a lot of research on kids with complex developmental trauma. And one thing she has found for sure is that exercise and being outside really does help them. It helps their mood. And Bruce Perry also talks about this. Sleep, if they can get it. Kids with trauma, maybe this is going to be a situation where a child who you think should be sleeping in their own bed maybe is sleeping on a mattress in your room because they feel safe, and then they can have better sleep, and then their brains are going to work better. There was a good article this summer in the New York Times about the shortage of medication for ADHD. And it was just, there's a lot of quotes in there from families and how they were managing. So this mom says, we try and manage with a couple of caffeine drinks during the day and soccer in the afternoons, right? So, right, these are sort of lifestyle choices, I guess, a good example. So neurofeedback, I don't know how much people know about neurofeedback. If you can get to New York City, we're going to actually be doing a training on September 29th and September 30th, a Friday and Saturday. It's going to be for parents and practitioners. And we're actually bringing Arleta James in from Ohio and Mike Cohen from Florida to do this training. The amazing thing about neurofeedback is it actually creates almost permanent change versus medication, which I'm going to talk about in a minute. Medication has to be in your system to be effective. It's not going to change your brain. Neurofeedback will do that. Sometimes people need little boosts of it after some time. So, and I'm happy to talk more about it. Maybe at the end if people are interested, but basically neurofeedback has really shown to be effective, one, for complex developmental trauma and also ADHD. It's as effective, certainly, as medication is for ADHD. And the whole goal is to bring your self into a calm, attentive state, which is the opposite of what we're talking about today, right? So it's what we want to achieve, right? I had somebody who had ADHD who actually did neurofeedback, and when they described what that felt like afterwards, they said, well, I can follow a recipe now. This was like a college student in their 20s. I can pay attention when people are talking. I found that kind of remarkable, because to think about that, like, I can pay attention when people are talking, how challenging life must be if you can't actually stay engaged in a conversation, right? And I knew this person fairly well, and I was still so taken aback, just, really feeling empathetic for them. So, okay. So here's just a little bit about medication. So for ADHD, you can try stimulants. So Adderall, Ritalin, and Concerta. So this is a quote again from that article, are one of our most effective treatments in psychiatry, period. Right. So they definitely work. Those are brand names, those medicine names up there for amphetamines or methylphenidates. Sometimes people use off-brand names, medications. The one thing, and I love this quote here. This is a kid in that article says, I felt like a better me, like how myself should be, right? The medication was super effective in just allowing the child to feel like themselves and in control each day. But I think that important thing to know about stimulants is that, and this is sort of back to the quote from the guy who wrote the book on states of mind, stimulants make anxious people much more anxious. I've worked with a few families where they've tried kids with complex developmental trauma on tried stimulants, and the kids became so anxious they were becoming very paranoid, like almost hallucinating about what was going on around them. So it wasn't really making them focus in a really positive way. It was kind of a scary experience. So medication for complex developmental trauma include clonidine and guanfacine. These are alpha agonists, which downregulate the sympathetic nervous system. So they decrease the arousal response, right? So it's something happens and it's just not as big a deal. You have to monitor blood pressure because the medications lower blood pressure. And I believe these are used, I mean, these have been around for a long time, used for heart problems. They can also make kids sleepy as they are adjusting, which is also kind of interesting, right? They're not so anxious up all the time. They're kind of more relaxed, and they can get, so sometimes you have to sort of figure out when to give the medication. I worked with one family, they got up at 3 a.m. So the child wouldn't be sleepy at school. So it was just sort of the right, that's where they gave the medication. And then SSRIs, which are given for anxiety and medication. And I just love this quote here. So early caregiver adversity changes the biology of a child by altering both their brain architecture and their response to stress, giving them a hypervigilant and alert sympathetic nervous system. These children exhibit hormones, a stress response that is out of proportion to a given stressor, and secrete much higher levels of stress hormones compared to age-matched, typically developing children, right? So, and also it's like out of proportion to a given stressor, it's also can be, I would say, almost like a secret stressor, right? We may not understand what is stressing out a child because we haven't been with them in their early time. So we, there's a lot of things that might make them very anxious that don't seem obvious to us. So I'm going to stop screen sharing now so we can all see each other. I just want to open it up for questions to see if there's anything that didn't make sense in the way I explained it. And I also just want to say these are kinds of our theories right now on what we'd say, no, I don't want to say abnormal, but like different than the typical kids, right? So these are just what people love to categorize and think about things. It just, a lot of these labels are given just because of the environments that kids live in. I often say to parents that school is not really normal for humans, right? For thousands of years, many thousands, nobody went to school. We were walking around outside, doing active things. And that probably made us feel much less anxious. So we wouldn't, learning to reading is not a natural human thing either, right? Reading didn't come around for a long time, and now we use it. It's very helpful and handy to share information, but humans have changed the way we live over time, and it really impacts our expectations. A friend of mine just told me recently that anxiety is the common cold of our time because of the way we live. So Felix, I see you have a hand up. Why don't you go ahead?
Hi, thank you very much.
Oops, you just went on mute again. Just if you, go ahead.
Sorry.
Yep, no problem.
So again, regardless of the diagnosis on ADHD and CDT, is there a specific difference in the treatments? Because the treatments appear to be pretty much the same, albeit that the goals are different and the diagnoses, of course, being different and for good reason. But actual treatments, is there a treatment difference, between them?
I think the treatment difference is kids with ADHD can feel bad about themselves because maybe they can't sit in class or whatever, and they can get down on themselves. But I think, like, in terms of understanding like a therapeutic intervention, that would definitely be something that would be much more recommended for complex developmental trauma, right? So I think, so that would be an intervention difference. The medications, I would say, but I think general lifestyle wise, and parenting wise, I probably not so much. I mean, I think if a kid is very hyperactive, and they might, just like my aunt did, have them run around the house a few times. If your child though is way more hyperactive than they've been previously, then it's kind of like, whoa, what's going on? That's when like PACE, right? The pace, playfulness, acceptance, curiosity, and empathy, especially C is the most important letter, curiosity. What's going on? You seem really, really active tonight, and I'm noticing this, blah, 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 right? So that wouldn't really be relevant for ADHD because that kid is the same level. And again, I'm generalizing of activity, you know, a day to day, right? There's nothing that's triggering them. Does that make sense?
Yes, so, and again, medication wise, or even with the neurofeedback, it's generally pretty much the same, but intervention wise, therapeutically is different.
Therapeutically, it's different. And neurofeedback wise, it's also different, right? So they have these protocols that, and Mike Cohen from Florida actually is a big specialist in ADHD. Arleta James is a national specialist in complex developmental trauma. So he says, I really can't do this training for you guys because I understand the population you serve. And I think we need somebody there who's a specialist and using the appropriate protocols for complex developmental trauma. So I can't really tell you, I'm a surface level. I understand neurofeedback. I'm not a practitioner, but they'll be able to explain that in the training.
Thank you very much.
You're welcome. Yeah, looks like Colleen maybe has her hand up.
Hi there. Really good stuff. So I had a foster child that just was returned recently to the biological family. They were twins. They both had ADHD, and of course they've had significant trauma. They were they were diagnosed at 3 years old. They are now 5 years old. And I found it very difficult to find the appropriate therapy for them to coincide with the ADHD, because we wanted to make sure that along with just the medication, there was a therapeutic piece to correlate to the. So is this neurofeedback that you've been speaking of, is that going to be more popularized for people to have access to? I think a lot of the times with the foster families and adoption families, there's a need for that neurofeedback. I think that's very important.
Right, that's a great point. And it's funny, we had Arleta come to our conference a number of years ago and talk about neurofeedback. And the main comments after were, how dare you bring somebody to New York State to talk about something we don't have here? Like, that's not fair. So Pat and I have been working really hard, as long as many other people at the coalition, to actually get more practice here in New York. So we're hoping to do this first cohort, and then we're hoping that we'll bring them back and do another cohort. So in what we really at the coalition, we strongly believe in training professionals and parents together, because parents really do all the work, right? We're professionals around our own kids, and we're having all the therapeutic interventions, anytime, all the time, except for when they're in school, which is not the majority of time. So, so we will, be doing this neurofeedback. You can do neurofeedback at home. Also, there are practitioners that do it. Arleta works on a home-based model. So you purchase the equipment and you do it. That's also a difference. So ADHD, I'm not exactly sure what the protocol is, but I think it could be once or twice a week. For complex developmental trauma, you actually need to do it much more often, like 3 or 4 times a week because there's a lot more change that needs to happen. So it's a lot more cost effective and easier on schedules to have it in the home. So I hope we get better at having that. The other thing about, not every kid wants to talk about trauma. First of all, they don't remember a lot of things that happened to them. It's all very murky, right? I was lucky with one of my kids who had a lot of trauma, because I was there, for most of her life. But it's neurofeedback can fix things without knowing all the details, right? And it's a very low lift for the child. Like, they don't, some kids, they'll say to me, like, I really don't want you to know my inner thoughts. I don't feel safe. I don't really trust you. I don't want to tell my parents everything right now, and what I'm going to like squeeze it out of them like a tube of toothpaste. I mean, no, that's not right. We want to respect, like, this is when you're ready. Not everybody's the same. There's some research coming out around trauma, saying some people just don't share it all. And actually that's a healthy response for them to be functional and happy in life, right? Some people, if they really need to work through it all, and some people say, actually, there's other ways, right? There's no, there's many things that can help us heal. Yoga is another one, actually, that I forgot to put on the list. And neurofeedback's another tool, which can be very, just another way to get it at healing. You're welcome. Any other? I see the chat is full. Sam, I don't know if I haven't been monitoring that. So is there any?
I was going to say, I think you actually answered a lot of these questions in your presentation, but if Sarah didn't answer your question, if you wouldn't mind either typing it again or just unmuting yourself. Tracy, if you want to share more about your experience with neurofeedback, please feel free. You really did answer a lot of them as we were going along. Kathleen asks, will meditation help similarly to neurofeedback?
That is a really great question. I haven't looked at the research exactly on that. But it definitely, it's going to be a similar effect, right? Meditation, yoga, right? That those are things that bring us into a calm, attentive state. What I have found, so those were things I used to recommend all the time. It's hard to get people to do them, neurofeedback is, it doesn't require as much input from the kid. So my youngest, I actually pay her to do neurofeedback. She's in college and she needs money. So, it's a really great way to give her spending money. And she's always like, oh, I'm like, oh, all right, no problem. Just do your neurofeedback and, and it really benefits her. She's bought into it. She wouldn't do it if it weren't for the money, but it really does help keep her in that calm, attentive state. And then she can make really good choices for herself. So yes, I think it helps similarly. I don't think it would be awesome to have like a study of like those 3 interventions, as well as probably like walking outside and see, what the change was over time. Oh, okay. And Tracy, it looks like maybe, okay.
Yeah, Tracy, I don't know if you're child free now. Okay.
Yeah, I just had to tuck her in, give her a dog, say goodnight. We just started at the beginning of summer, and initially we were doing it once a day because we have the equipment at home and check in with the with the person. I don't know what her title is. And she actually, after we checked in the second time, had Keegan start doing it twice a day. Keegan will not do the bedtime one, cannot. So she does 2 during the day. One of my questions was, how long is there like an average, how long someone with trauma does neurofeedback to be beneficial?
Oh, how long does it take? So I would
like an average of.
Yeah, it's, so I think if you're talking about, trauma, it's probably going to be a year. It's a long time. I have a child, who came from a really, really challenging orphanage, experience as a young teen, who's done 700 sessions of neurofeedback over many years. And it's actually really made, a tremendous difference. But to be upfront about it, a lot of people will say, oh, 10 sessions or 20 sessions, that's not going to be enough. It's not going to, it might help. Like one of the kids I've worked with recently who just started it says she actually, she's a teenager, that the quality of her sleep is better. That's the first thing that she noticed. I think her sleep is deeper. She's not sort of half awake during the night, but then to actually have, sustained change where just like that boy on the ADHD medication, you feel your real self. I think it has to be a longer, just much bigger effort, I guess.
Yeah, I can say I'm doing it as well. We had a very traumatic spring with her eloping a lot. So I'm doing it as well. And I am doing the nighttime one. And I do notice a huge difference. If I skip a night, I am more restless in the night than if I do it. And I sleep much better. So we had like a 2-week lapse where the headset had broken. So we were waiting for a new headset. And it was fascinating to see the difference. And I am less reactive doing it regularly. And I noticed a slip in that with the 2 weeks off that we had.
Wow.
And obviously not as much trauma, but probably some ADHD. Like we were just starting to talk ADHD meds for me as an adult, but decided to try this with her. And so I don't know if I see much difference in her yet, but she also had more stuff going on when she was younger and more stuff going on now that I'm sure is creating more trauma at times.
Right. Thank you so much for sharing that. That's, I think, really helpful to hear from somebody who can really talk about their experience. I would say after, with one of my kids who tried neurofeedback, the first thing I noticed was when I said she wanted to do something, and I said, and this was probably 2 months in, I said no something, which of course we all know is not the right way to start a response to these kids. And she didn't freak out. She wanted to do something with her friend. She said, no, mommy, let me just explain to you this. I'm not asking that. I'm asking this. And I was like, oh, okay, that's fine. It wasn't this immediate, my life is over. You've ruined my life. I never get what I want. Life is so unfair, blah, 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 blah. It wasn't that. It was like, she stayed in the moment with me. She thought about, maybe what I was thinking. It was just remarkable, like to be in that same calm space with her. When she did first start it, it made her very, very sleepy. Which is interesting, reminds me of what the clonidine often does. The practitioner said basically she was so up all the time that to be in a more relaxed state actually made her feel very sleepy, because it was not, so she kind of had to adjust to be in a more normal state. Right. Any other things that people would like to share, or other questions, or okay. Well, yeah, we got one more from Colleen. Oh, you're on mute, Colleen.
Sorry about that. Could you just kind of explain to me what neurofeedback kind of looks like? Is it a therapeutic session? Is it a module of us learning how to parent? Like, what does it look like?
Yes, thank you for asking that. Yeah, so the way someone first explained it to me, so biofeedback has been around for a long time. Like yoga or meditation is a form of biofeedback, right? Like I'm going to lower my blood pressure really just by changing my breathing. So this person explained to me, like, You know, how do you think like deep sea divers who really have to change the way they are breathing to actually be able to go down so deep and hold their breath for so long? How do they do that? They actually practice that above ground and eventually learn to adapt their physiology, right? They're changing their physiology. Complex developmental trauma, you're changing, right? Your physiology has been changed for the worse, and we're trying to get it back to be better. They also said to me, think about somebody who's walking on hot coals. Well, I never had any idea how that was done. Well, apparently, when you learn to walk on hot coals, you learn to increase the sweat to your feet, right? Somehow you get yourself in that state, and they're sort of more sweaty, and it protects your feet from the burning coals, right? So we can change our physiology of our bodies, even though most of us don't think about that most of the time. And so what neurofeedback is, you put sensors on your head, which is recording the electrical activity. We all have electrical activity that goes on in our brains, right? And there's certain frequencies between certain sections that are associated with positive states, right? So if you're looking at people who are calm and attentive normally, this is kind of what their brains look like. And when you first do neurofeedback, you do this QEEG, which is like a map of the brain, just recording how is your brain looking, right? And this is really fascinating. It's a little weird. I hope I can explain it properly. So when you make your brain be in a calm, attentive state, because these sensors are recording. So if it's going well, it's going into this computer, and then the movie that I want to watch will play. As soon as the sensors notice that you're not in that state anymore, the movie might stop, right? Or will stop, or the video game will stop. Unconsciously, your brain will make the shift to make the movie play because it wants to continue watching the movie. So someone explained it to me as, it's when you're learning to ride your bike, you don't think to yourself, I have to balance, I have to do all of these things. And, you know, your brain naturally figures that out to coordinate your whole body to stay on the bike, right? We're not conscious of it. It's hard to describe to somebody how you would do it, right? And that's because your brain gets in this naturally sorting things out all the time. So one of the first things that neurofeedback was used for was migraine headaches. And that's how I started it with one of my kids, actually. A neurologist had suggested it. And that was actually just 8 sessions. In 8 sessions, this child who was having migraines that were interrupting her capacity to go to school. And I remember once being in a car with her, and she said, hold on. And then she just sort of closed her eyes. I said, what are you doing? She said, oh, I'm feeling a migraine. I'm getting myself in that state that my, is warding off the migraine. It really was amazing. I mean, she was vomiting, they were terrible. I asked her recently, can you do that now? And she said, oh no, I've lost the magic ability or whatever, but she could do neurofeedback. Again, she doesn't get them anymore. It was a kind of an adolescent thing. But she could go back. That's what I'm saying. Like, well, medication, you have to take it every day to have an effect. Neurofeedback lasts for quite a while, but sometimes people say, then I go back and get a little refresher to help your brain unconsciously, and your brain is sending signals to the rest of your body about what hormone should be released and how you should be responding, right? And the brain is misfiring when you've been in these stressful situations. It's always thinking you're about to be attacked or mostly neglected, right? Left alone. That's what most of our kids are afraid of. So I hope that gives you an idea. It's not doing anything to you. It's helping your body do the right thing for you. Okay, great.
Sarah,
Okay.
I have a follow-up question to
Sure.
that, to what you just said, because I think for us as adoptive parents, thinking about complex developmental trauma in terms of relationship too, and how important relationship is in the healing for our kids.
Mhm.
And so I guess I'm wondering, does neurofeedback, the effects of neurofeedback, have you seen that once they're compliant with that treatment, the relationship building, the connection, the ability to connect, the ability to reduce fear, all the things that we're trying to do in therapeutic parenting, like sticks better, for lack of a better.
That is such a great question. Exactly. It's not going to magically change the relationship, right? You have to be right. So when I was saying, like with my daughter, she didn't get upset. We didn't have this big rupture. We were able to stay in relationship because she was not triggered by no, right? One thing I've also noticed, just because I've only worked with these kids, that I've noticed that when kids are swimming, and also in hot tubs, that sometimes they also get in a calm, attentive state. I always say to the families I work with, make sure you travel to any place that has a swimming pool, because it makes a big difference. So I've had conversations with some of my kids when they're in the water, and then they're like really just totally different people. Like I see their real self, I feel like. Somehow, I don't know if it's like an in utero thing or what it is exactly. But yeah, so the neurofeedback helps them feel in that safe place more often. And then they can be in relationship, kind of just like all of us, right? If we're afraid, right? It's just that their situations are usually more extreme.
Yeah, I guess I wanted to ask that because we would never want to encourage people to just send their kid off to do neurofeedback and not do the work ourselves as a parent
Absolutely.
to, right? So it's in conjunction.
Right. And you wouldn't say like, oh, great, we can just put all these kids in, orphanages and then give them neurofeedback. And, that's cheaper than finding parents. It's not going to work, right? It's not, you have to have all of the relationship building, to actually, right, change and have a better life for them. That's right, which is our goal, right? Felix, yeah.
Well, Samantha was starting, and I thought she was going to go a little differently. In that, a lot of when you were talking earlier about and showing the slides with the how are the ADHD and CDT are different, the phrase kept popping up. Kids, that had had a close relationship with their biological, and you kept using, with the biological. And I'm just curious overall, how big a difference, because again, when we talk about those traumas, absolutely. When we talk about those early life traumas, even more so for all our kids, so just in regards to going back to the diagnoses between the two, for the ADHD and the CDT, it seemed like like a given that all of our kids, for the most part, have those early life traumas, depending on the age upon which they were removed, and or the placements and all of which you've mentioned. But there was so much speaking about how, kids who live with their biological families and have ADHD versus kids who have CDT. And that comparison, is it, is one more prevalent than the other? Because I mean, nowadays doctors or therapists give out an ADHD diagnoses, 1, 2, 3. And I like when you came up with the whole, if they have ADHD, they have it all the time,
Right.
versus, they don't have that normal speed. So is that the major like rule or difference or change between them, regardless of if they're with the biological families or not?
Yeah, I hope I can answer this right. So, right, I think everyone on this call, our kids have complex developmental trauma, right? They all have that. How it manifests itself can be different. Some kids can go through a lot. Personality is inherited. Obviously, it's always going to have an impact, but some kids can. I've worked with twins before. They have different capacities sometimes, you know, so they have been through the exact same situation, very traumatic situations, and some find, you know, what they decide internally to do and how to address what's happened to them and connect with people can be different, each one. So, right. But all of our kids have trauma, and they may have ADHD on top of it, right? They may have had that before they had the trauma, right? Because ADHD is something in utero. So they may have had that. It's just, right. But I think I mean, people are saying all the time, you know, there's just all this, so many articles about this, so much diagnosis. There was an article in the New York Times, just like 2 weeks ago, where saying about women who don't manage their money, and maybe it's, you know, ADHD, and, something about handwriting, which I didn't really follow, but anyway, saying, you know, if you're impulsive, you know, and you have a hard time planning, that could be hard to manage your money. So somebody said to me, oh, maybe, you know, this is relevant for one of your kids. Well, what's that person doesn't know is that for this child, she's the one I was telling you about, who's in the shelter, she can't think about money because she's so terrified she's going to end up back in that shelter, right? So she can't, it's not, I'm not, you know, she may have some attentional or impulsivity issues, but the main problem for her is her early experience, this implicit memory of being in a very unsafe, impoverished environment. So one thing that we had to say to her is, you know, we want you to find a job and support yourself, obviously, and be happy and all that. But we will never let you are never going to live on the street. Like, you can always come home, you know, we can help you with your rent, like, because she couldn't be calm enough to think about money at all until she felt secure, right? And that, you know, made complete sense, but took a long time to get to that for her to really have that insight about herself. And then for us to be able to respond, you know, appropriately, making her feel secure so she could think. And now she's in a place where she can actually be a better planner, still work in progress. But anyway, so I hope that answers, you know, I can't even say like this specific percentage of the population has ADHD, because I think, you know, it's just such, any child who can't function in school, oh, ADHD, you know, teachers are telling the parents, you have to get this child on medication. I mean, I can't prescribe medication. I'm a clinician, but I'm not a medical doctor, right? You have to really be very thoughtful, because you don't want to make the situation worse, obviously, by making your child very anxious, if, you know, you're inappropriately giving them stimulants.
Thank you very much.
Any other thoughts? All right, I thought maybe I would just end with this really interesting paper that somebody shared with me called Toward a Theory of Child Well-Being. And it's a paper about like, how would we define well-being for children? And I just want to share like some of the points in here that I thought were really interesting. First of all, that mostly and actually this, our US Children's Bureau says when they have these measures, they want to think about safety, permanency, and well-being for children. And well-being is one of the things that they don't really have a good measure for. And I think it's such a relevant topic. So one of the things they say is that well-being, you know, mostly is the definition is around what's good for adults. and that a child is doing well to the extent that he becomes a well-functioning adult. And that doesn't mean that that child has well-being themselves, right? We're not just like little automatons who have to go out and earn a lot of money or something like that. And so they talk about, what would a good theory of well-being be? And it says, so they have these two notes, so that the child develops those stage appropriate capacities that would, for all we know, equip her for successful future given her environment, right? And that is really a challenge with a lot of the kids, because if those children stayed in the environments that they were in, a lot of their reactions actually would be appropriate. It's just that we've changed environments for them, and then that stuff's not as appropriate anymore. And I love this one. And engages in the world in child appropriate ways, for instance, with curiosity and exploration, spontaneity and emotional security, right? That really is something important with regard to well-being. And then it says the ability to, so talking about what does make one a good, what is really important in childhood. The ability to secure attachment is one example of the set of skills needed for a successful adulthood. The acquisition of self-regulation, right, that we don't blow up when we don't need to, the ability to communicate and to learn, and the ability to form social relationships among others, right? So those are things that really are very important in terms of well-being, and gets back to my point about school, right? None of those things are really taught at school. These are the things that you are working on with your children that are going to be, right? So there's research showing, for example, that your capacity to be in relationship is much more important in your future than how good you are at school, right? You might get good grades, but if you can't keep your job because you can't stay in relationship with your coworkers, you're not going to have the easiest life. And then just the last point I wanted to share was this statement says that differently abled children cannot automatically be assumed to be deficient in child well-being, right? Differently abled children cannot automatically be assumed to be deficient in child well-being, right? Can we have some joy in our everyday? Can we, right? Can they play with us? Can, we read to them and they enjoy that, right? And so I love this because it's sort of, my point is like to get away from the labeling and the negative parts of things and trying to make kids always fit into a certain structure, and to think if we can focus, and probably you all do already, but just to focus on, being in connection with each other, noticing when they do something and they feel really proud of themselves that they couldn't do before, even if it's not appropriate, compared to their peers or whatever, but that just, these small accomplishments. And that's, a way that I love to think about child well-being. I thought that might be a good note to end on. So I thank you all.
Thank you so much, Sarah. I know I learned a ton. Hope you all did too.